It's the second Tuesday of the month, and here we are at the Berkeley Heights YMCA for our wellness workshop. It's all about shin splints, the top 5 exercises that you can do to prevent and recover from the runner's nemesis, shin splints. I'm Dr. Donald DeFabio. Sit down, relax, enjoy the seminar, and get ready to do some exercises because that's what it's all going to be about, exercising the shin pain away. Here we go. Well, good evening. Thanks for coming out tonight. It's all about shin splints, the top 5 exercises to heal and prevent the runner's nemesis. I'm Dr. Donald DeFabio. I'm a chiropractic sports doctor in town. I am a chiropractic physician. I'm a corrective exercise specialist. I'm also the team chiropractic doctor for Drew University, and it's great to be at the Berkeley Heights Y for our wellness series. So thanks for coming out tonight, and let's get started. The runner's nemesis, shin splints. What are our objectives tonight? Well, it's very simple. We want to talk about shin splints versus tendinitis. Are they the same thing? Are they not the same thing? What else could it be? My shins hurts. What else could it be? How about prevention? We want to talk about prevention of it, as well as rehab and exercises. That's what it's all about, the top 5 exercises for rehab of shin splints. And then we'll touch on additional treatment options, things you can do. Shin splints, the pain. Is it bone or muscle? Well, let's look at this. This is your tibia. This is your shin bone. In fact, I have another picture over here. This is a good picture of the shin itself, okay? So here's your lower leg. The knee is up and through here, and it comes down into the lower leg and ankle. You can see you have muscles on the front, and then you have muscles behind that attach to your shin bone or your tibia, all right? And inflammation of those muscles is what creates shin splints. If it's in the back part, those are called posterior shin splints or medial stress syndrome. That's the big name for it. If you Googled it in research, you'd put that in if you wanted to find out. If it's in the front, along the front of your shin and to the outside, it's going to be anterior shin splints, okay? So if the pain's in the front, it's called anterior shin splints. If it's more towards the back and on the inside, it's posterior shin splints. But what is it? It's pain in your lower leg, where across that big bone that goes up and down your shin bone, shin splints. What usually happens with shin splints? Well, it happens a lot with runners, happens a lot in the military, happens a lot with people on their feet a bunch, all right? But is it bone pain as we were just talking, or is it muscle pain? Well, let's look at that next slide. Well, here's the top of your knee, and then this is the shin bone. And you can see this is where the muscle attaches. This is the anterior, the front shin bone. Now, it's a little tough when you look into the picture here, but the muscle is the red part, and then the bone is this gray part. I'll use my hands to describe what it looks like. Muscles and bones don't attach like this. They just don't lay on top of one another. Let's say this is the muscle and this is the bone. They actually attach like this. So if the muscle's all inflamed and raw and sore and attaches to the bone like this, that's why it feels like it's bone pain. So the bone will actually hurt, but it could be coming from the muscle. All right? So is it bone? Is it muscle? Well, they both hurt, but the driver could be muscle to give you that bone pain in your shin. All right? So that's what we have to look at, and that's how a tendinitis or an inflammation of the muscle where it attaches to bone, that's the tendon, would give you pain. So the first thing we have to look at is an accurate diagnosis. Well, here's your shin. It hurts. My shin hurts. Well, is it really shin splints, an inflammation of those muscles that attach to the shin? Or is it compartment syndrome? Well, compartment syndrome is, if we were to look at the leg over here, all right, the muscles are in compartments of the lower leg, all right? And we're going to see a couple of different compartments over here. In the front is one compartment. To the side is another compartment. If you ever cut a piece of meat like a leg of lamb or a chicken leg, the meat's in little bundles, right? In the leg, those are compartments. Same thing with us. We have compartments in the back of the leg. There's 2 compartments there. We have a compartment on the outside. We have a compartment in the front. But those compartments can get swollen. They can get inflamed. they can get mad, and that can give you pain along the shin, all right? They can also compress the nerves in the area. That can also affect your circulation. That is not a good thing to have. And if you have that, you have to treat it appropriately. But what if it's not a compartment syndrome? What if it's a stress fracture? I mean, the tibia is a bone pain, muscle pain, remember? The muscles can make the bone hurt. Oh, it's just bone pain, but it's coming from my shin. Well, what if the bone is fractured, a small fracture, and that's giving you muscle pain? Remember, they attach together. So it could be a shin splint. Something else that has to be differentially diagnosed. MRI is great for that. For compartment syndrome, the diagnostic test of choice is sticking a needle in there and checking the pressure in the compartment. Make sure it's not building up. So these are the differential diagnoses. But what about a DVT? Who knows what a DVT is? Deep vein thrombosis, right? The calf muscle gets all swollen and inflamed and irritated. Like you look at this calf muscle and it looks okay, but in reality it's all swollen and inflamed, not from tendinitis because there's poor circulation, phlebitis, deep vein thrombosis. Another differential we have to think about. And it could just be a muscle tear. You could have just torn the muscle, okay, and not inflamed it. So my job is the first thing, wherever you go, is to get an accurate diagnosis for your shin pain. But everyone's had that tonight, so let's go right and talk about shin splints. By the way, I want to welcome my live audience. Thanks for coming. Give yourselves a round of applause. It's always great coming to the YMCA. So what are the causes? The most common causes of shin splints are lower extremity pathomechanics. That means your foot, ankle, knee, hip, and pelvis aren't working properly. Either the joints aren't moving properly or the muscles are imbalanced, all right? Overuse or underuse injuries. You could be overusing the muscles, or you might be underusing other muscles and they can't keep up, creating an imbalance. The imbalance can be to the front, to the back, to the left, to the right, to the top, to the bottom. Exercise volume could be a problem. Going too fast, increasing your volume too quickly, all right? You're on the elliptical or you're running or you're walking at a certain amount, and then all of a sudden you decide to do more real fast, okay? Or the intensity changes. You're doing a certain amount of exercise at a certain intensity. I do level 3 on the elliptical for 45 minutes, and then all of a sudden you decide to go to level 8 on the elliptical. Boom, the intensity changed. That'll give you a problem. Or the terrain will change, especially in runners, okay? Soft terrain to a hard terrain, going from the treadmill to outside, things like that. The terrain can change, all right? That will impact it. And then with running, we talked about the anterior shin splint. We talked about the posterior shin splint, the one on the front. Well, if we look at the heel strike on this last picture on the bottom, when your heel hits, your toes are up in the air, your anterior muscles are the ones that are working. So people that run with a lot with their heel and they're really pulling those toes will be more prone to shin splints also in the front. Then your foot goes down, and then when your foot lands and goes into what's called mid-stance, the posterior shin has to work. So if your arches are low, if this is what's happening over here on this picture, your arches are dropping, that posterior tibial has to work more, and that's why that gets inflamed and sore. And this is just a diagram on the side of how if the foot pronates or rolls in, causes the knee to roll in, causes the hip to roll in, causes the hips to become unlevel. Conversely, weakness in all these muscles in the hips and pelvis can cause the knee to roll in and the shin to roll in, the foot to collapse. So it's all tied together. So you can't just look at the shins as a standalone problem. It's related to the whole lower extremity. So if those are the causes, what are the prevention? Prevention is you want to correct those joint and muscle imbalances. Make sure your alignment's good, make sure all the joints are moving properly, make sure the muscles are all working well. You need to stretch the tight muscles, and you need to strengthen the weak muscles. You need to create balance. You have to do self-care, and we're going to talk about self-care tonight. That's going to be the emphasis of the show, all right, is what you can do at home, and we're going to go over that, all right? But you have to be diligent with it. This is not one of these easy fix problems. It's one of these things that takes time to get better. You do have to look at your footwear and the surface you're on. If you're a cook and you're on hard linoleum floors, it's going to affect your feet and shins. You got to have good footwear. You got to stand on a rubber mat. If you're exercising outside, are you running on asphalt, or you're running on grass, or you're playing on turf? Are you inside, or are you in the treadmill, or are you in a hard concrete floor, okay? And your footwear. Are you wearing the appropriate footwear for that activity and for your feet? You also have to fix any training and technique issues, okay? If you have poor technique, that could be driving your shin splints no matter what you're doing, all right? Speed kills, all right? We talked about intensity with our training. The biggest thing that drives injuries is doing speed work, fast work as an athlete. Going from a normal pace to a real fast pace gets you into trouble. And for our runners, another thing which gets you into trouble is you avoid the 10% rule. In running, there's a rule is as you're ramping up your mileage, you want to ramp up your total mileage or your total time 10% a week. When people ignore that and they ramp up that volume too fast, that oftentimes gets us into trouble too. So prevention, maintain the 10% rule, don't overdo it with the speed training, fixing your technique flaws, and then the other things we talked about. And especially using the diligent exercises at home. So, self-care. That's the first thing we want to talk about tonight. We're going to go through the discussion. It's going to be much easier. Then at the end, we'll do a breakout session, and we're going to talk about all of the exercises, and we're going to do them together. So it'll be easier to go through it, and then we'll do all the exercises, and then we'll come back and finish up the show. Okay? So, self-care. Using a massage stick works really well. And a foam roller works really well. For all of my athletes, these are mandatory, and for anybody that wants to maintain elasticity and flexibility in their muscles, they are great. The foam roller, it's a little bit more difficult to use in that you have to get on the floor. It does give you more authority to the tissues, okay? However, you have to get on the floor and you roll on it. Rolling on the foam roller is what finds the knots, the tightness, the areas of stiffness. Setting on it, letting your weight get on it for 30 to 40 seconds breaks the knot down. So rolling finds it, setting on it releases it. The stick, the massage stick, rolls over the muscles, and we're going to go over that in a moment. Great to find it and to loosen it up. It's quicker, it's easier. You can do it sitting, you can do it standing. It is much more efficient, just doesn't penetrate as deeply. They're both excellent. You also have to strengthen those weak muscles. This is what we're talking about being diligent with your self-care. The strengthening exercise we're going to go over, you need to do it 3 times a week to every day. 3 times a week is minimum. You need to build it up to 3 sets of 15 to 20, at least once a day. Twice would be preferable, okay? So this is why I was talking about being diligent. It's not just about doing them once or twice. You really have to do them over time. And the foam roller and the massage stick before every workout, but you can also do it after, and you can also do it every day. There's no contraindication to it once you start using it and you know how much pressure to use. Anti-inflammatory diet, everybody knows, it's been here before, knows I'm a big fan of the anti-inflammatory diet. You eat the right foods to suppress inflammation. You can take nutritional supplements to suppress inflammation, and it just really, really helps your body to heal. So, balancing mechanics, the second phase of treatment. How do we do that? Well, we talked about it, stretching and strengthening, and it involves your calves. And you have to do both. You have to stretch your calves and you have to strengthen your calves. You have to do both. Ironic, but the calves have a tendency to get tight, but they also have a tendency to be weak. So they need the power to keep you stable and not to get overworked when you use them, but they also have to have the elasticity because muscles are elastic. They're like rubber bands. You need to strengthen your hip and core muscles in through here. Why? Think back on the picture we showed a few moments ago where the hips were off and the foot was dropping. So you need to strengthen the muscles in the feet to keep the foot straight, but you also have to strengthen the muscles in the hips and pelvis. You need to support the feet if necessary. May not be needed. Taping, kinesio taping, or a more rigid taping, or orthotics are options. If they need support, you put it in. Chiropractic adjustments as needed to make sure the joints are moving properly. If the joints aren't moving properly, you can't exercise them and rehab them properly. Footwear may or may not be an issue. Just have to be concerned about it. All right? Stretching. This is what we're going to go over tonight. Gastrocs and soleus are your calf muscles, two major muscles of your calf that must be stretched. All right? Hip flexors are the muscles that run in through here and they drive your leg this way. So we want to specifically stretch the upper hip flexor because that's the toughest area to get to. When you're doing your stretching, you want to hold for 20 to 30 seconds, 3 times, 2 to 5 times a day. And you can also do dynamic stretching using a stretch strap. All right? So static stretching is fine. Dynamic stretching just gives you a little more authority. This is for the gastrocnemius, standard runner stretch. This is for the soleus, with the back knee is bent. This will get down by the ankle. Dynamic stretching using a strap will get the same area, and you'll get a little on the hamstring seated, okay? But it's for the gastrocnemius, back of the calf. And the hip flexor, kneeling hip flexor, gets way up and through here, all right? And we're going to go over all those momentarily. Strengthening. You have to strengthen the calves and stretch them. It is a dichotomy, but you need to do both. Anterior, posterior tibialis, we're going to use a stretch band for that, which is the front of the shin and the back of the shin we talked about. Gluteus medius, glute max, that's the butt. Really important, all right? And then hips and core. One of my favorite for the calves and one of the easiest one is eccentric loading of the calves. Toes on a step, you push up, hold, 1, 2, and go. This is going down on one leg. You can go down on one, or you can go down on 2, but it's slow on the way down. 1, 2, 3, 4. Go up. This picture, it's shifting to 1, and then slowly down, 2, 3, 4. It's very important you go slowly down because when you run, when you walk, when you move, you have to decelerate. You have to slow down the pressure. That's what prevents the muscles from getting torn and inflamed. Lying on your side for the hips, one of my favorites for the glutes. Keeping the glutes strong is really important to protect the shins. And core stability is also tied into that. Because if you're stable here, then you'll be stable into your lower extremity. Strengthening, here are the pictures. Pulling up. There's the posterior tib. This was the anterior tib. And again, we talked about the calves. All right, so we're going to be doing all those momentarily. Hips and core, side lying leg raises, making sure you're feeling it in the butt, not in the thigh. Bridging gets the hips, gets the core. If your core is not stable, you're losing energy transfer. If you're sliding around in through here, then the lower extremity is going to slide around. It's going to put more strain on the feet when they're not supposed to be working on keeping you stable through the core. So the core has to be stable. Using a stretch band to hit the hips, a little bit more aggressive, okay? They all work very well, but you have to hit them all right? So what we're going to do is I'll just go over the support, then we're going to break. Let's do a little breakout. Let's go over some stretches, okay? Then we'll come back and we'll finish everything up, okay? So when we come back, we'll talk about this. Let's do some exercises. We'll practice our stretching. We'll get out the band, the foam roller, the stick, and then we'll finish up, okay? So let's go over the gastroc and soleus stretches, all right? So the first thing we want to do is right foot forward, left foot back, all right? Feet straight ahead. They don't have to be in line. They can be separate left to right, but the toes got to be pointing straight ahead. So you point that back foot straight ahead, right? And now drive the right knee forward, and that you feel it in the back of your calf. That's the gastroc stretch, okay? Now there's another muscle back there. Straighten both legs. Now, keeping feet straight ahead, heels on the ground, bend both knees at the same time. That'll get in the soleus area. In the deep, that's going to get in the back leg down by the ankle. So can you feel the difference? One's gastroc, one's soleus. So remember we talked about those compartments? The anterior compartment's here. So stick the anterior compartment all the way to the anterior. That's your anterior shin splints. The outside is the lateral compartment. Then the back. She did the back in the middle. And then the back on the inside. So the stick is great for loosening up those knots. So that's how you use the stick. So you roll the foam roller on the calf, and you look for the areas of tightness or knots, and then when you find them, you just set on it, okay? You get a little more authority doing that way, or you can just do the one. But you can go to the outside, roll over towards me a little bit. So that's the lateral compartment, right? She just did the medial compartment. You can roll the other way, go back to the medial compartment, okay? So you can roll that way. So you can still get all the way around the shin with the foam roller. You look for the areas that are sore and tight. And then when you find an area that's sore and tight, what do? Set on it. It's like the Ronco. Set it, forget it. You find the knot and you set on it for a good 30 seconds. Posterior tib runs on the inside, down and in. Good. Stop for a second. Open it up. Spread the band out. Hold it up. Out to the side. And go down and in. Good. Up, down and in. Slowly recover. When you use a stretch band, slowly recover. Because if you just snap it back, you did no work. The stretch band did all the work. Somebody step on that. There you go. And then pull up, Claudia. And slowly relax. And then pull up. And then slowly relax. So you tie it down to the bottom of the bedpost. Have somebody else stand on it, okay? You can wrap it around to anything. If you can do it sitting down and step on it with this foot and drape it over the top of the foot. Relax for a second. So if she was sitting down, she can step on it with this foot and then pull her toes up that way, okay? Another variation. Slowly down, 2, 3, 4, and get a good stretch. See, this gets both. I love this exercise because it stretches and strengthens. What do we need to do to our calves to prevent shin splints?
Strengthen and straighten.
Strengthen and stretch. This does them both. When this gets easy, you do more advanced, which is go up on 2, shift your weight to just 1 foot, and then slowly down, 2, 3, 4, and come up and relax. Toe down, foot slightly back, lift up, and then slowly down. What we just talked about before, down, that eccentric is really important, and down. Because if you go too fast, gravity's doing all the work, and you're not doing any work, all right? So we want to go slow on the way down. You're not supposed to feel it here. You're not supposed to do this. Jane Fonda, okay? I'm dating myself. But that's going to work the hip flexor. We don't want the hip flexor. We want back in here, the glute. Tighten the abs, pinch the butt, and bridge up. Hold 1, 2, and how long on the way down? 1, 2, 3, 4. Because again, if you go right down, gravity's doing all the work, you're not doing anything. Now, when that gets really easy, you can get more aggressive by same starting point, except you're here. Knees stay opposite one another. Tighten the abs, pinch the butt, and you bridge up from there. And then slowly go down. Advanced. All right? So if we want to stretch the hip flexors, a nice way to do it's kneeling. And when you drive forward from the pelvis, that's it, keeping the pelvis neutral. Okay? And that'll get you up in that upper hip up and through here. All right? A static stretch, how long do we hold our static stretches for?
20 seconds at least.
Very good, at least 20 seconds. That was perfect. And you drive forward. Now, she's on a mat. If there's any pressure to the knee, you have to put toweling back there sometimes, okay? You're not bending forward this way. You're keeping here, yet you're also not bending back, okay? Because that'll jam up your spine, and then you will need to be into my office, all right? So release the stretch. See the core stays stable, the pelvis and the hips and the spine stay stable, and you drive the hips forward. How long do we want to hold that for?
20 seconds or more.
There you go, at least 20 seconds. I tell you, I got a great class here. So that's your hip flexor stretch. You can relax for a second, Claudia. So what do we have? We have our stretches. Gastroc and soleus, standing. They're great. Hip flexor on one knee. If that's too much pressure on your knee because you're on a hard floor, make sure you're on a padded surface or a towel. Use your foam roller. Use the stick for self-myofascial release. Get the exercise band out for your posterior tibialis and your anterior tibialis. Posterior, and then the anterior strengthening. Then do your eccentric calves for strengthening. All right? Gonna hit your hips and core with bracing and bridging, sideline glute medius. And there you have it. I actually gave you 7 exercises for shin splints. But do them all, do them diligently, and it's going to be great. So, thank you. Let's go sit down, and then we'll finish up. We're going to go talk about support appliances, additional treatments, and we'll be all done. All right? Good job. All right, welcome back. We did our stretches. Any questions? There were some really good questions. You had a question. What was it?
I do. I notice a pattern that when I exercise my legs, there are 2 points that become a little swollen right there.
Yeah. When you're having recurrent pain from exercise, it's either a mechanical imbalance, joint imbalance, or a muscular imbalance. Okay, so something's not working right. Bursa is a sac that's filled with fluid that surrounds the joints to offer shock absorption and to protect tendons and ligaments, and they can get inflamed. So you can get bursitis in your knees and your hips and your elbows and your shoulders. When they get inflamed, they get mad and they get sore. But it's not the bursitis, it's what's causing the bursitis. Somewhere there's a mechanical imbalance. You correct the mechanical imbalance and then you won't get the bursitis anymore. All right? Yes?
Another question that I have is walking on carpet.
Mm-hmm.
For me, that is a no-no. I mean, I feel so unstable. Does that affect your legs or what?
Well, when you're walking on a softer surface, you're going to have more work. Your balance muscles have to work more. So you may not like that because it's harder, literally. That also means we may have to work on some of those balance muscles so that you can tolerate it. So some unstable surface work might be good. Getting on a small trampoline like a rebounder would be good for that. Yeah. So support to protect this. The orthotics are inserts for your shoes you can use, taping and strapping. It's common now, the kinesio tape, the elastic tape, compression sleeves, and you can see how an orthotic works over here. Supporting the ankle prevents it from rolling in because along the inside of the ankle is that posterior tibial tendon. The foot rolls in, that posterior tibial tendon gets mad. Balancing the kinetic chain, chiropractic adjustments and corrective exercises can be done with stretch bands, can be done with hands for the adjustments, but those are the corrective exercises to reinforce proper alignment, just like we were just talking about. So let's finish it up. My top 5 exercises for let's sum it up. My top 5 exercises for shin splints are stretch your calves, got to stretch your calves. The gastrocnemius, both of them, okay? Soleus, gastrocnemius, both of them need to be stretched. Eccentric calves, going up, hold 1, 2, slowly down on 4. Really important, especially for our runners, because that affords support for deceleration phase, all right? Sideline glute med raises. Lying on your side, hit those glutes. Glutes got to be strong. Protects the knees from rolling in, and therefore the feet won't roll in. Anterior tibialis with band. Let's get that anterior tibialis strengthened. And then lastly, my posterior tibialis with band. All right? If you have more of a posterior tibial tendon problem, well, you may not need to do the anterior at all. If you're having more of an anterior front shin splint, you may not need to do the back one at all. But those are my top 5. However, you got to make sure to foam roll and stick. You got to make sure to do the core strengthening, all right? And you have to do your overall prevention. Keep your calves stretched, maintain foot, core, hip strength, use the right footwear. Don't do any thoughtless things with your training. Avoid the excess speed, avoid the excess volume. Fix any technique problems, and avoid pro-inflammatory foods. So those are my top 5. Thank you for coming out tonight. We're going to finish up with any other questions, and we'll be back in October. So any other questions? Clear as mud?
Yes.
I think you've answered this on the eccentric calves. When you lower, the heel below, hold it for 3 seconds or so.
Yeah. 2 seconds up. Hold 1, 2, 1, 2, 3, 4. Get a nice stretch at the bottom, 2 to 5 seconds, and then come back up.